Hi, everyone, and welcome to the live stream of today's event with Pharmacists United for Truth and Transparency. I'm Lauren Young. I am a pharmacy owner in Illinois, and I'm the vice president of PUTT. And I want to introduce anyone who has not had the pleasure of meeting Andrew Russell, our wonderful board member from Minnesota. Hi, Andrew. How's it going?
It's going great, Lauren. Thanks for having me. For anybody that doesn't know, I'm Andrew Russell. I am an executive board member at Pharmacists United for Truth and Transparency, also the co-chair of the PUTT Action Network. I own a pharmacy in Elko, New Market, Minnesota, small independent pharmacy, and really just excited to be here with you today, Lauren. What are we doing today with our hearing? What's going on?
So I love a legislative hearing. I watch them on the state level. I watch them federally. I really try to drill down and see what is being said. What are some key points that we are hearing from all of the different stakeholders? And so today there is a hearing from the House Judiciary Antitrust Subcommittee. And ranking member Jerry Nadler is going to be speaking. And we are very excited about our friends from New York getting some representation. Shout out to PSNY, the Pharmacists Society for the state of New York. We've had some longtime friends up there, and they are real. I guess we always talk about the PBM mafia, but they are real gangsters in New York. I mean, they are serious about fighting PBM reform. I know, shout out to Danny Dang. I think
my man Danny Dang. I think the first podcast I did with PUTT was with Danny Dang. He's the man.
That's right. And Steve Moore also with PSNY. And it's really amazing to get to see the different pharmacies work together. And I know there's several people that are watching this live stream and tuning in to see what the committee is going to say today. And that's really why we wanted to kind of come on and give you a little preview about what's going to be said, what we're going to hear today, and then cut to the actual streaming of the hearing. But I know that we've done this a few times before for other committee hearings and kind of big events in this space. So we are so happy about this. But one of the major things that we get to do is really kind of showcase what is important on the legislative side.
Yeah, and we've got 3 representatives that'll be on the committee panel here, right? We've got Jerry Nadler out of New York and Becca Balint from Vermont. Anything exciting going on in Vermont?
So we usually hear about Vermont from the Senate side with Senator Peter Welch. And so we have gotten to see his support of some of the PBM legislation, or really the PBM issues. You know, the not wanting to support monopolies has always been a big portion of that. And that kind of is why we hear his name a lot in the PBM pharmacy world. So we are very thankful for all of our friends in the Northeast that are fighting PBM reform and fighting for independent pharmacies. But we're excited to hear what Congresswoman Balint has to say as well.
Yeah, certainly a little bit of a monopoly situation going on in pharmacy, right? Third member here is going to be somebody from your home state, Chuy Garcia.
That's right. Congressman Garcia gets to be on this panel today, gets to be in the committee today, and gets to talk to some of the wonderful panelists about PBM reform issues. And everyone knows that one of our favorite congressman from Illinois is Congressman Raja Krishnamurthy. And he is famous for bringing the very large billboard size posters. Whenever DIR fees were a huge problem for pharmacies, he was in those hearings fighting for pharmacies, talking about the huge percentage of discrepancies that they're seeing in DIR fees. And so he has been a champion in that for us. And so I know that he has spoken to several of our other Illinois House members about issues pharmacies across the state of Illinois and across the country are facing. I know that some of those closures are happening in the Chicagoland area. You know, a lot of people think that closures are just happening in rural parts of states. They're thinking, oh, those are areas that don't have as many people, so they're not able to have any of those businesses, just tumbleweeds or, rocks and cows, as we've heard some of the people say about some of the rural areas in the country. But this is really where people are all still in the urban areas are fighting for access. You would think if you're in a huge metropolitan area, whether it's St. Paul, Chicago, anywhere, you're going to be able to throw a rock and hit a pharmacy. But there is a large number of pharmacies closing because of steering towards mail order pharmacies or steering towards even their own retail stores. So we have been very lucky to also be able to follow our friends from Arkansas who have great job over the last few years, but especially over the last few weeks.
They've been making headlines all over.
Yeah. So, and Andrew, I know you weren't on the PUTT board whenever the Arkansas bill happened in a few years ago that sparked the Rutledge versus PCMA kind of Supreme Court issue. But I know that you have been very adamant about supporting all of the PBM reform legislation that has happened since then.
Absolutely. Yeah, no, we've been all over it. And that bill that passed in Arkansas is absolutely phenomenal. I think it's a kind of a new strategy, a new way to think about how we can start breaking up some of these monopolies and breaking up this vertical integration that is just absolutely destroying pharmacies throughout the country. In Minnesota, I know we're struggling with rural pharmacy closures and pharmacy deserts in our urban areas too. Minneapolis, St. Paul, it's been pharmacy closures one after the other. I think we've closed 40 pharmacies in the last 2 years in Minnesota. So it's a real issue. And I think we need to come up with some good solutions here. Mm-hmm. I think might be a decent idea to talk about who might be on our panel here coming up.
So we have 5 panelists today that are going to be at this subcommittee hearing. And first one is Matt Seiler from National Community Pharmacists Association, NCPA. If anyone has been around legislative topics, they are usually familiar with NCPA and Matt Seiler, since he has been supportive of what is going on across the country. Usually there's a letter that you see in support of what is going on in a specific state, or maybe they're also garnering additional support by trying to get pharmacy owners to submit, whether it's letters, make phone calls, all of that. So, and it is NCPA fly-in week. So there are lots of pharmacy owners and advocates coming to the nation's capital to talk about different PBM reform issues, trying to get legislation to the finish line as opposed to just in a committee or even heard about at a hearing. So we are still really excited about what is going to happen this week, because there's going to be, again, like we said, people knocking down doors in Congress, trying to get meetings with legislators to see what exactly is going to potentially happen. And I know that legislation works at a glacial pace on the state level. So sometimes, it feels like things are almost moving backwards at the congressional level. And so it's really imperative that we are continuously keeping our legislators accountable and giving them all the information. I know that there are reports, Andrew, that you have ran and information you have drilled down into so that you can talk to your legislators about what's going on and why the talking points they're hearing from PCMA or the opposition lobby is not what your patients are seeing, not what other people in our industry are seeing as well.
Yeah, and I think as soon as they start seeing the actual numbers and are starting to understand the situation, I think more and more of our legislators are really starting to understand that we do have a big issue here. And it's something that a lot of our state legislators and a lot of our federal legislators are getting behind, which is very good. We're excited to keep going. And I know the PUTT board is going to be in DC this week in absolute full force, working for our members and our pharmacies across the country. So we're very excited to get out there. A few of us are out there already laying the groundwork.
That's right. We have another member of the panel, Brandy Chain pharmacy owner from Texas, one of our fellow friendly executive board members from PUTT. And we're so proud of her that she is able to represent her patients, her community, our PUTT members, pharmacy owners across the country, patients on this panel. And so, I know that sometimes whenever they put a panel together and it's PBM executives or insurance executives, and they're really also wanting to hear the voice of the people that are in the trenches every day and that retail front line, hearing from patients. That's really what they're trying to get to. And Brandy has no shortage of stories of patients. So that'll be very helpful. We're excited to hear what she has to say. We're very proud of her for stepping up and doing this. Another panelist is Ashley Bacot from the Rosen Hotel Group and resorts in Orlando, Florida. We had a PUTT summit in 2021 at the Rosen Center in Orlando. And it was a great way to not only get PUTT members and other pharmacy stakeholders together in one room, but we were also talking at that point about how pharmacy owners can connect with employers in their area. And so I know that I've had the pleasure of sitting with your business partner, Matt, at an insurance company training. And as soon as I saw Elko New Market, I'm like, yes, that has to be someone that knows Andrew.
Absolutely. Shout out to Matt.
So that, this was a few years ago, whenever we were at the Rosen Center, we were talking about how employers are trying to lower their costs, but also keep their employees happy by not having them have terrible health plans where they're not able to go to their pharmacy of choice. They're not able to go to other providers of choice. And so really that was how they were able to take on that industry, because they're in a industry similar to pharmacy where there's a lot of chains, there's a lot of big players in the hotel and resort, tourism industry. And so it's pretty impressive what Rosen Hotels has been able to do. And their mission behind it is really incredible. So I would definitely suggest taking a chance and looking up to see what Rosen Center and hotels have done over the past few decades. It's really impressive. But he's going to be talking about it from an employer perspective. So we have NCPA as the national association. We have an employer representative with Ashley Bacot from Rosen Hotels. We have the lovable Brandy Chain, pharmacy owner from PUTT, and Bill Schmidtnick. Now, Andrew, I know you have spent quite some time with Bill. Why don't you give us a little insight into Bill?
Yes, I have. Bill is one of my my dear friends. I've known him now for I guess a little over a year. The circumstances in which Bill's become involved in the PBM reform fight and advocacy in general is an absolutely heartbreaking story. His son Cole passed away due to not being able to afford his asthma inhaler, and due to some formulary changes, I think we'll say, in on their health plan. And it was a terribly unfortunate situation, but Bill has been committed with his wife Shannon to making sure that Cole's death really hasn't been in vain, and he has been leading the absolute charge for patient advocacy. He has been all over the place, and if you haven't seen him yet, you will very, very soon. If you're a state out there looking for somebody to come and help you at one of your state events, or just need somebody to talk to you about PBM reform in general, Bill's going to be your guy. He is a very, very fluid speaker. He knows what he's talking about, and he's angry. He's angry. He's an angry dad. That's where you find him, at Angry Dad, So,
yes.
But he's a very lovable person as well, and their family is fantastic. And I enjoy all the time I get to spend with Bill. I'm looking forward to spending some time with Bill this week as well. So I really looking forward to that. And I'm sure we'll hear a lot about Cole's story today and a little bit about what Bill's been up to. So that'll be good.
He's really fighting in Wisconsin.
And he is fighting it. Yes.
Senator Filskowski has really championed Cole's bill. And I'm so grateful for that, because this has been he's so passionate.
He is.
Bill is so passionate about wanting Cole's legacy to be positive. And as a parent, that is so wonderful to see him turn this tragedy into something that will help.
Exactly. I think if there's a record for knocking on doors in a certain time frame, Bill might have it. He is absolutely relentless when it comes to just talking to legislators' offices, knocking on doors, making sure people know that this is an issue and we're here for it, right? So that's where it's going to come from, is keeping our legislators informed and accountable, and he's been doing just amazing work. We're happy to work with him, and I'm proud to know him, and I'm excited to see where this is going to take us this week and going forward. I think last but not least, we have one more panelist too, Dr. Jim O'Leary. Why don't you tell us a little bit about him?
I know that we have worked really hard at PUTT to bridge the gap as pharmacy owners, pharmacists, to also working with physicians on PBM reform, because they're seeing a lot of the same pushback on the insurance side. They absolutely hate the prior authorization death wheel that their patients are on, or the step therapy issues, or any of the other roadblocks that are preventing their patient from getting the medication that they want them to be on. And I know that how frustrating a lot of the providers are with the fact that these insurance companies are now playing doctor for their patients and choosing what therapy that they're on just because that is the therapy that's best for their pocketbook. Right, that's really what the PBMs are fighting for. They're wanting to make sure that they get all of that money. And so that might not be the best medication for your patient, and that's not their fault. But so Jim is great on social media, really understands the issues that pharmacists are finding. They understand that, because the physician really is choosing the medication they think is best for the patient. They're not trying to drown the patient in unnecessary copay costs or anything like that. I know that we work with a lot of different providers' offices, and also trying to make sure that we are able to offer a great cash price if it is not covered by insurance. And that's something that, the doctor really wants them to be on. We do a lot of magic tricks and jump through a lot of hoops for our patients. So I know that you do as well. You're a pharmacy, Andrew. And so, but I really will say, Dr. O'Leary is a great resource to have. He has also championed other providers to come alongside their pharmacists, and also champion his patients to go and seek out independent pharmacies. And
Absolutely.
So he knows.
Yeah, no, and I think the relationships that we build as independent pharmacists with our providers, at least I know from my experience in our area, goes a very long way for our patients. I mean, the healthcare system in general is so complex, and just having a few people that understand how to navigate that, the system is a tremendous benefit for our patients, I know. And I know that we get a lot of great feedback from the clinics in our area, that they love working with us as an independent pharmacy. They know we care about our patients. And even if they'll call us if they have questions for patients that aren't even our patients. What do I need to do to get this medication to this patient? And we're happy to help them out. I think as more and more independent pharmacies close, we're going to be losing that connection, and everything is just becoming so siloed and corporatized that I think we all need to start banding together and really trying to fight this from a unified front. And I think Dr. O'Leary is really recognizing that and really helping push that charge. So it's been very, he's a good follow. He's been he's well versed in what he's talking about. So I'm very excited to hear what he has to say on the panel today. I think this is going to be a great panel with some very, very strong voices, some very smart, intelligent voices, and it'll be very interesting to hear what they have to say.
I completely agree. We've had some comments come through so far, and just want to reiterate what our friend Joe out in Massachusetts has said. The Arkansas bill is a historical event. It is amazing what they've done in Arkansas. John Vinson deserves a statue in every single state. because as the executive director of the Arkansas Pharmacists Association, he has been such a driving force in putting patients first and making sure the access to those pharmacies, whether it's an independent pharmacy or not, is available. There are a lot of different options in the healthcare spectrum, and John does a tremendous job of making sure that his pharmacists are connected to patients and their legislators. Those legislators in Arkansas are not dumb. They have heard all of the talking points from both sides. They were able to get clear, concise information similar to what you were showing your legislators in Minnesota. Yep. And they were able to see the losses in black and white. They were able to see the steering in black and white. I mean, there is no gray area here. It was really impressive whenever we were watching Arkansas, and there was Representative McGrew mentioned that there were some opposition emails that he had received. Yeah. And when he contacted those individuals, because he is a great legislator and he wants to make sure his constituents feel heard, and he was going to tell them, going to talk to them about why they were opposing House Bill 1150. And whenever he reached out to them, they did not actually send that correspondence to his office. They were not in opposition to the piece of legislation, and they drilled down into it, and they were chain pharmacy patients that were also owned by a PBM. So
sneaky.
Just when you think that rock bottom cannot get any lower, they find a new layer to be at. And so he really took them to task for that, because that is terrible to flood legislators' offices with these fake opposition emails whenever this is a serious issue that's hurting patients across the state. And again, this is not because we are trying to penalize any of those big chain pharmacies. It was because patients need access. They're being steered to different pharmacies that are just profiting off of patients instead of looking for better healthcare outcomes for them. So that's really, and that those entities had a choice. They can still have a pharmacy in the state of Arkansas.
That's right.
They just can't be owned by a PBM.
Yeah.
And the backlash and the opposition that they faced for that was because they saw that money train leaving if they were unable to keep having all of these issues. So that was really important to see, and we loved supporting our friends in Arkansas. Representative Jeremiah Moore, Representative Brandon Aker, who is a pharmacist, by the way, and then Senator Kim Hammer. They are really, really impressive. If you have not had a chance to go back and watch that, absolutely do. It is wonderful. It's like watching old game film from, some college football playoff, series win. It's really incredible to see what they're able to do, how they're able to take those talking points that the legislators are getting hammered with every single day and really have some truth and support. But New York has filed a bill very similar to this, and Vermont has also, and Texas. There's a few more states that are trying this, and we know that there is still opposition. This will not go in place until 2026. So there is some, potential for what happened with the Rutledge versus PCMA, how there will be, or as we saw in Oklahoma in the Mulready case, there's potentially some opposition fight back. And so if that happens, Arkansas is ready for that. They have support from their attorney general, which is great. The governor was able to sign that into law. So that's also incredible to see that support. And we are actively looking to see what other states are moving forward with that. But again, kudos to Arkansas for just being a leader and a winner in this. Again, the PUTT board, several members are traveling to DC this week for the NCPA fly-in. So if you are a PUTT member, just definitely make sure, and you're going to be in DC, or you are an NCPA member that has not connected with PUTT, in person. We would love to get a chance to talk to you and meet with you and, cheer you on as what you're doing in your state. Happy to be a resource and whatever we can do. But there has been so many issues that we have seen recently. There was a letter that 39 attorneys general were able to sign on to. And, I was very proud that Illinois' AG was one of them. Minnesota's.
So it was Minnesota, yeah.
Right. Little known fact, my cousin actually works for the AG's office in Minnesota. That's right. Board President Deb Keveney has been on a call with him as well. But he is a pharmacist by trade and an attorney. So he just glutton for punishment right there. And, but it's really impressive to see so many states attorneys general sign on to this, because one part of legislation is obviously getting it passed, and the other part of it is making sure the enforcement piece is right there, as we've seen in other states whenever things get passed, but don't have any of that support. It's really, really hard to have any accountability for the PBMs. If they're not seeing a fine, if they're not seeing a license being revoked, if they're not seeing anything but a pharmacy owner mad at them, they don't care.
Right. Arguably, I'd say the enforcement piece is almost the more important piece, and I think that's the beauty of the Arkansas legislation is it's pretty cut and dry, pretty easy. You can either be a pharmacy or you can be a PBM, and they are there. You can only have a license for one of the two, and I think that is a very elegant solution, and I think it should be rolled out to a lot more states, and I think it will be.
And they did have, and Arkansas didn't just wake up one morning and think, how can I ruin PBM's lives? They had last year, the attorney general was able to, and the insurance commissioner were able to have a press conference about the $1.5 million in fines that were levied because of so many different complaints and issues with PBMs not following their very clear-cut laws that had been on the books for several years. And they were happy to just keep paying those fines because that's not even couch cushion money. That's like money you find in the parking lot at the grocery store money for them.
Built into the business model now. Yeah,
yes.
I mean, it's just the cost of doing business. We've run into that situation in Minnesota as well, where PBMs have been fined, just slap on the wrist fine, and business as usual, and until we start seeing some meaningful enforcement of some of these laws, I don't think anything's going to change. So it's a very interesting concept, and I think it's going to take off. I really, really do like it.
I'm very, very happy with it. Again, there's 39 different attorneys general. This is not a red or a blue state issue.
Yeah, that's a good point too.
Bipartisan. That's what's super important to remember about this, because it's so easy to get disenfranchised or just so upset that there's nothing moving. And, we get so close. At the end of last year, there was talk about there being PBM reform in the end of year healthcare package. Yep. And unfortunately, that was not the case. And so we start to feel a little bit like Lucy and Charlie Brown with a football, where there's going to be PBM reform and then it's taken away. So again, the pharmacy owners that we talk to on a daily basis, and if you're on the PUTT PBM reform WhatsApp group, you hear about that
daily,
hourly, if not daily.
Yeah.
So,
and if you're not a part of that, you should be, if you're interested in this. So reach out to us, reach out to me. We'll get you in that chat, and you'll learn some things about PBM reform, and you'll understand what we're doing at PUTT, how we're helping other states accomplish some of these things, and just bringing great ideas together. I think has been just the whole reform chat has just been such a catalyst for other states and understanding what the real issues are and what's working here, what's not working here, what can we do in our own states to push for some of these legislative solutions. and I think it's just going to get better. And I think we are rolling, which is going to be good. And we're going to be taking DC on in full force this week too. And I think there's a lot to be optimistic about. It's tough. It's easy to get down when we get beaten time and time again. But these little sources of optimism are fantastic for everybody. And I think as long as we all stick together and keep the message going forward, I think we're going to be going to great places.
And Andrew, as the co-chair of the PUTT Action Network, there's multiple states that the Action Network has talked to and gotten, groups of owners together and talking, because I know sometimes people feel alone. They're shouting into the void, and, or maybe they've talked to their state association about it, but they just can't quite get that traction that they're looking for. So the PUTT Action Network really does give those owners a sense of community and updates and things like that.
Yeah, absolutely. And I think a lot of state organizations have they've got a diverse group of members, right? So they're not often always geared towards independent pharmacies. I know there's a lot of states out there that their state associations skew more towards the clinical side. Unfortunately, I feel like sometimes Minnesota's been one of them. So we've gotten a long way with our Mindy's organization, or the Minnesota Independent Pharmacists, spearheaded by our PUTT president, Deb Kevney, which has been she's been an absolute force in Minnesota and on the national stage. I'm proud to be learning and following her in her footsteps. And right now in Minnesota, Mindy's is doing some really good work, fighting for the legislation we have going, and we've got big things to come in Minnesota as well. Looks like we have a question here. If we anticipate additional problems pushing legislation through Minnesota when United Health Group is sitting right here. We are located right in the heart of the beast. My own pharmacy is a half an hour away from United Health Group and Optum, and also a half an hour away from Prime Therapeutics. So I am very, very familiar with both of those places, and I can anticipate there might be some pushback to some of these things in Minnesota. But at the end of the day, I think the amount of data and information that's out there showing some of these abuses and showing how these giant conglomerates are they're siphoning billions of dollars out of the healthcare industry on the backs of taxpayers, on the backs of patients, on the backs of providers. Really, it's going to come down to what does the data show us? And I don't know how much of an argument they're going to be able to push back on that. But true, the battle is going to be uphill. It's going to be difficult, but we're here for it, and that's what we're doing. So I think there's some optimism in Minnesota. I think there should be some optimism across the country, and I think we've got a message here that's really resonating. And I think the more people that we can get together, the more minds we can get together, the more different members or different sections of the healthcare community, be it doctors, nurses, whoever, dentists, bring them on, anybody, I don't know, come on over, right? So the more we can shine a light on what's going on with these big healthcare conglomerates, the weaker their position is going to be, and the stronger our case is going to be to be able to provide the care for our patients that we need to. And I think we're headed in the right direction.
I completely agree. And I think that, we're seeing a lot of that groundswell of support from other providers, other people, other advocates, other groups that we had not been able to get the support from, because they always assumed that it was pharma that was being an issue with driving up drug prices. And so, that does tend to be a scapegoat for a lot of things. And, they're not perfect. There's a reason why they're still able to have drugs on PBM formularies, but really the crux of it is a lot more people understand that PBMs are just taking all of that money from the healthcare sector and not putting it back towards the plan sponsors, not putting it back towards patients, not putting it back towards even the insurance groups that they say they are, And so this is why I think this is such a great time to be a loud advocate for this. So definitely be connecting with PUTT, whether it's through the PUTT Action Network, through one of our WhatsApp groups, through different groups on social media. And like you said, Andrew, it's going to take everybody coming together, because we know Deb is a fierce warrior in Minnesota, but you guys and Mindy's have all come together and really had a way to get that to the next level this session. And we're so proud.
Yeah, no, in Minnesota, we have a lot of very active pharmacy owners, and we've come together in a very, very strong way. And it's been very exciting to be a part of that process. I mean, there's just so many smart, talented pharmacists out there that I think are finally getting their voice and trying to find an outlet, I guess, to have their voices heard. And I just really think that some of these grassroots type efforts that's where they're going to be led from. And it's interesting too. I think another good point is employer groups, right? So I think our employer groups are starting to wake up to the fact that, maybe our pharmacy benefit managers don't have our best interests at heart, and truly, when we think about who the customer base is for PBMs, it is those large employers or the government. And it's not necessarily patients in general. So having our employer groups understand what's happening behind the scenes with PBMs has been pretty eye-opening for them as well.
Oh, absolutely, because they assume that their broker is giving them all the information. And then whenever we at the pharmacy level are able to drill down into some of those explanations of benefits and really what the copay is being pushed to the patient, that is what we have been seeing. And we're opening their eyes, and they're saying, our costs keep going up. How are you guys closing? How is their pharmacies closing that,
right,
we're using? This is crazy. And, it just keeps coming back to the same issue that we are not seeing any of those, increased dollars. And so it's just, we are looked at as like a slush fund for the PBMs. They just keep tacking on a new admin fee. They keep, we keep exposing them, keep pulling back the curtain and showing different tricks. And they just have a new one lined up just in case.
Right.
So, it's if you fill a prescription on any day that has a vowel in it, then you're going to get an admin fee.
Or why? Yeah.
Like, sorry, that's your bad luck there. But we just continue advocating for patients. And Heather brought up a good question about, have you written your DOJ complaints? There is a link in the comments that we can also post on social media. And this does bring us to another discussion, because part of this committee's basis today for the hearing is about the FTC reports that have come on board in the last couple years. And I know that the interim reports have been invaluable to pharmacy owners that have felt so validated by what we have given the FTC, what we've talked to legislators about, what we have shown countless times to anyone and everyone who would listen to us. And so that's really the important part of this and the crux of this. And so there have been several different owners that have talked with the FTC, and two of the FTC commissioners did potentially get fired. They have kind of stepped back a little bit, but they're still very vocal on social media. And obviously, we really miss former chair Lena Khan. I think Jeremy's, BFF in.
Very sad day for Jeremy, yes.
The antitrust kind of goals that she had, and trying to break up monopolies, and just really understanding what patients are looking for in this whole issue. And she came to Illinois. She had a listening session with Congressman Raja Krishnamurthy, and we were able to be at that meeting and get to hear her in person. NCPA had her speak a couple years ago at their conference. She's had multiple different FTC open meetings where people could come and speak and kind of let their voices be heard. And so that really did give pharmacists some power and stake in the game. It kind of felt like a virtual rage room at times. They were discussing what was going on, but just to see the commissioners respond in a way that's, they're going through all of the documentation. They're able to ask questions to this committee to show them what was really, behind those closed doors. It wasn't just constant redacted material. Now, there were some PBMs who did not give up material. Mm-hmm. I know everyone is shocked by that. They would hide behind something proprietary.
I don't know. Yeah.
Never seen that happen ever. And anyone who's ever tried to redline a ESI contract really can understand that. Nope, that's not how things work. It's not going to work for them. But
there's no negotiating there, unfortunately.
No. So again, that the FTC, different studies that have come out, the different reports that have come out from the FTC have been strengthening our argument and what's happening. It's still important that if you have a connection with someone in the FTC that several of our members have utilized over the past couple of years, you are still sending them information because there are still people listening. There are still people fighting for us on this side. That we knew this was going to be a marathon, not a sprint when it comes to this. We have been bogged down by these issues daily for years. So it feels even more monotonous and slow for us, whereas, the FTC has multiple different issues that they're tackling. Right. So that's, got to give them a little bit of grace in there. But so far, the different people that have even recently spoken to the FTC commissioners and different individuals at the FTC are still impressed with the level of questions coming back to them. They're really getting this. They're understanding what's going on. They're asking, high level questions, not how do you spell PBM or, or whenever they look at Adam Fine from Drug Channel's new Chutes and Ladders chart as to what's PBM and
the new one's good. Shout out to Adam for that.
Yes. And so that's helpful because a lot of these individuals, these legislators, will see some of those names or some of those companies, but they don't understand how they are all vertically integrated, how they're all connected.
And so, horizontally now too.
Yes. And so it's
traditionally.
Absolutely. It's so important that you familiarize yourself with that chart, share that with your legislators, so you can see what's going on there. That's super important to follow a lot of these people on social media. I know that sometimes it can be hard to follow everyone because some of the opinions are not what we are hearing. I know that some of our friends in different states that were trying to push some important PBM reform legislation through, they get disheartened whenever they see either a letter to the editor, or they see an article and it's, talking about how these greedy independent pharmacy owners are just trying to keep all that money for themselves. And that does spark a lot of issues, but there are definitely a reason to follow a lot of those individuals on social media because the individuals who helped break the story in Ohio when the spread pricing in their Medicaid department was so rampant were journalists.
Yep.
So, that's from the Columbus Dispatch. So you definitely want to make sure you are keeping your local news organizations, reporters, everyone like that, and on board and just up to date on what's going on because they eventually will have someone in their life that has an issue with a PBM, and then it will become a priority for them. That's what we've seen. So.
Yeah, and absolutely. And it's more than just the FTC too. We've got the House Oversight Committee had a very, very compelling hearing last year in July. If you haven't seen that, check that out. I mean, there's been multiple news articles from very, very reputable news sources, New York Times. Everybody's saying the same thing except apparently one group, which is interesting to me. But the House Oversight Committee hearing, I think, was another inflection point in our battle here with PBMs, and there was some very interesting testimony by some high level people at these at the big three PBMs.
And we shout out to Chris Hobart, because from the PUTT board, Chris from Texas, he always reminds us that those PBM executives definitely were not telling the truth under oath, and reminding us to remind our legislators that we have to tell the truth. Pharmacists United for Truth and Transparency is kind of in our name. We're big fans of that. And so when you are under oath at a congressional hearing to blatantly lie, and Chair Comer did remind them of that in his comments. And so that was, I think you could hear the cheers across the country whenever he mentioned that. So again, we appreciate that. Yep, that's right, Chris. We love you. Keep killing it in Texas.
Absolutely. Yeah, I know we had the hearing on at the pharmacy, and we were cheering the whole time, and I couldn't believe some of the things that they actually said. Unless there's a new definition of steering that I don't know about, I think they're still doing it. And and if you're an employer group that is signing one of these agreements to have your employees forced to a mail order pharmacy, or I think you need to reconsider that. I think that was one of my favorite quotes that came out of Arkansas, actually, was if you have to force somebody to use your product, it's probably not a very good product. That might not be the direct quote, but it was something like that. So if you have to force somebody to use your product, you probably got a terrible product. Let's get back to voting with your feet. That's the American way, right? Let people choose. And I guarantee you, if you let people choose, we are gonna wipe the floor with PBM mail order pharmacies day in, day out, especially on service.
My dad has been a pharmacist for over 50 years, and he has instilled in us that if there was a level playing field here, that would be the easiest way to recruit pharmacy owners in the entire country. You would have, because pharmacists really do want to help patients.
Yes.
They are really trying to help get the right person, the right medication at the right time. That is, exactly what you want to accomplish. You are wanting to break down the barriers for your patients, whether it's because of a copay, whether it's because of traveling to your store, whether it is just trying to make sure that they can understand what their doctor told them when they bring in their 25 sheets of paper from their appointment, and it has their list of medications, and they can't quite remember which white pill it was that they needed filled, but they know they needed a white pill. Right. So, your pharmacist is going to take that time and go over all of that information with you. And, it's amazing. Again, my sister is a pharmacist, has been for a decade and a half, and it still is so impressive to me the way that a patient can say something, and, they'll say, oh, I have this cough, but I haven't been able to get rid of it, but I live in central Illinois, heart of cornfields and soybean fields. So everyone has allergies. It's kind of, with it. And this person was talking to her, and they are actually allergic to their lisinopril. Yeah. And my sister was able to help them get on a medication that they didn't feel terrible. And the patient walked in, the next month, and they said, Erica, this is amazing. I haven't felt this good in 10 years since I started taking the medication. So, I mean, the fact that pharmacists are able to help patients even when the patient isn't coming in for that issue is amazing. We have patients that bring their mail in to us that has nothing to do with our pharmacy, but they just want us to help them decipher this tricky letter that their insurance company stated, whether they can come to us, whether they can't, anything like that.
Which are often misleading too.
Yes.
Yeah, it's happened to us, I know, a number of times where letters have gone out saying we're not in network, but we are in fact in network. So I don't know. Can't always believe what they tell you.
Do you mean they're not being truthful and transparent? And
Weird.
So they haven't signed up to be PUTT members. Probably not.
Probably not. Yeah, no.
But we appreciate everyone who's joined us for this so far. We are hearing that there has been some technical difficulties, not on our end, but, technical difficulties with the live stream. So they are still working on it, but we are definitely going to give you a recording, as Shannon has promised. But there is some, action going on. Again, we've talked about the 3 members of the committee: Representative Nadler from New York, Jerry Nadler, Representative Chuy Garcia from the great state of Illinois, and Representative Becca Ballant from state of Vermont. And so they will be kind of presiding over this committee hearing. So, and Brandy Chain, PUTT member extraordinaire, is talking currently and talking about how unreal nature in terms of PBM contracts. Again, we know how much it costs to fill a prescription. There has been countless surveys done. This is not a new workflow situation that's happened. We've been filling prescriptions for decades, hundreds of years, and we know exactly how much it costs. So then to have a PBM say all of that work is going to be 10 cents, if 10
cents. Yeah, maybe if you're lucky.
Yes. Or zero.
Most often zero. Yeah.
It's like, in what world is anything worth zero?
Yeah. So I guess for all of our listeners out there, the hearing is going on. It does sound like there's a little bit of technical issues getting the stream growing. So we can provide you updates on how that's going. Sounds like Brandy did some work, like you said there, and then looks like Dr. O'Leary has been answering a question. He's saying he had to let 70% of their staff go. Now he can't do proactive counseling. Staff is now running to catch up. Let's see. Yeah, I mean, without having the stream on here, it's kind of difficult to give the live view. But Dr. O'Leary is saying the average physician has 45 prior authorizations per week. That's 45 conversations with the PBM per week that they have to have defending prescriptions they've written. Prescriptions that they're deciding, or that they're in their clinical judgment are saying is the best prescription for the patient, and they're having to fight for their patient to get that medication, and it's the PBM blocking that on them, and it's
absolutely nuts. Yeah. I don't understand how
non-medical switching
think this is okay. I love that he mentions undoing the 1987 hall pass to PBMs that allowed them to get safe harbor exemptions or kickbacks. Right. Amen, Dr. O'Leary. Amen. We would love to repeal safe harbor. There would be, I cannot imagine the celebrations that would take place across the country if that actually happened. Our good friend Bill Schmitnick wants to see pharmacies reimbursed. No games from PBMs, but, hopefully. And then patients would never leave a pharmacy without medication, I'm assuming due to the cost, as in Cole's story. So
yeah,
I completely agree. And I love this. But
yeah, hopefully we'll be able to post a recording of the hearing here, but
yeah. But I think we can wrap up, and we can post the hearing maybe in a little bit, but hopefully we're going to keep going. We can give you.
I mean, we can keep going, or if there's anything else that you wanted to chat about in light of this hearing, I don't know. Like I said, it'd be nice to have the hearing here, but I think they're bringing up some pretty good points.
Absolutely.
In the idea.
Mm-hmm. Again, and it never hurts to have our issues in front of as many members of Congress or as many eyes on Congress as possible. And so, we've done the work of drilling down, getting the information. And I mean, Andrew, kudos to you for being able to decipher a lot of those pivot tables and graphs and figure those out, because once there gets to be more than like 7 or 8 columns on that spreadsheet trying to figure it out, it's like that is so many numbers, and so few of those dollars go into our checking accounts from the PBMs. So.
Yeah, I mean, the data sets are huge. I'm by no means an Excel expert. I'm not gonna claim to be that, but I've had a lot of very good help navigating some of those things. But I mean, the data that we're able to put together and see is absolutely alarming and shocking, and everybody should be worried about it. And it should be front page news, unfortunately, and it's not. And I think it's gonna get there, but
we got to get loud. Keep being loud.
That's right. Yeah. So, I mean, it sounds like we're not going to be able to get the live feed today. So, thank you for everybody tuning in to hear us talk. It's been fun.
Appreciate this breakdown with you, Andrew. I love this. And Matt Seiler, don't want to leave him out.
Oh, yeah.
Independent pharmacies are at the mercy of vertically integrated PBMs. 100%. We completely agree, Matt. There is nothing sacred about the PBM pharmacy relationship, and we are completely caught in the middle as independent pharmacies. Pharmacies are continuing to close. As everyone who has followed Ben Jolly or the American Economic Liberties Project has seen those maps of pharmacy closures and how it just continues. We have a pharmacy that we had to close last summer because of those reimbursement issues. It's just so heartbreaking whenever you have to make that decision. And the fact that there are multiple pharmacy owners continuously having to do this every day because there still hasn't been relief from a problem that we know the solution is just heartbreaking. But
yeah, and without some form of meaningful reimbursement reform very, very soon, we're going to see a continued escalation of pharmacy closures, and that is not going to be good for our patients. It's not going to be good for our communities, and it's not going to be good for our providers. So it's very, very rapidly approaching a situation that is absolutely catastrophic. I would say a crisis. So I think this is something that we need to keep front and center in the minds of our legislators. We're going to be doing our best at PUTT to be loud and vocal and bring those grassroots together. We're going to be showing up in DC. We're going to be showing up to our legislators' offices in our nation's capital and our state capitals, and we're not going to stop. So if you're out there and you're feeling alone as an independent pharmacy owner and you're feeling like you don't have a voice, reach out to us, because we will help you find that voice. We really do pride ourselves in not speaking for you, but giving you the resources to speak for yourself. And if you're not comfortable doing that, we can certainly find somebody to help you. And it doesn't matter what state you're in, we'll find you somebody.
That's right.
We're very good at it.
Action Network is no joke. We have connections and different owners across the country. And it's crazy the different connections that continuously pop up as the Action Network gets stronger and more members. So there's multiple WhatsApp threads that we can also connect you with as well, especially if you're going to be out at the NCPA fly-in this week with us. So
come find us.
And again, this is a broadcast about the House Judiciary Antitrust Subcommittee. So definitely want to make sure you are staying up to date on all of the different committees. I love legislative season. Feels like March Madness to me, because there's, multiple different hearings going on at different times, on different screens I have in my office. And just impressive to see that PBM reform is still happening and we're still pushing forward. We will be posting this recording and then also a link to the recording of the House Judiciary Antitrust Subcommittee hearing today as soon as we humanly possibly can. But Andrew, thank you so much for sharing the day with me and getting to dive a little deeper into PBM reform and legislation across the country. And I cannot wait to see you soon.
Absolutely.
We'll be there. And watch out, DC. Here comes Pharmacists.
We coming.
Well, have a great rest of your day and great rest of your week. And it is National Superhero Day. So if you see an independent pharmacist, make sure you thank that superhero in your life, because that is definitely who needs a little bit of encouragement during the end of the month, no reimbursement notices that we're getting. So again, have a great, safe rest of your week.
And thank you to everybody that tuned in for our live stream here. We appreciate you.
Yes.